Welcome to Tri-County Allied Health School's virtual open house. Today, we're going to talk about starting your career in medical coding. I am your presenter, Nicole Tran. I am a school advisor at Tri-County Allied Health School, as well as a project manager at AE and Associates. Today's presentation is broken up into 3 different sections. In the first part, we will discuss all about medical coding as a profession, including what is medical coding, how information flows for coding, what does it look like, growth in the profession, and the different credentialing organizations that certify medical coders. Next, we will explain who we are, classes offered, and what your options are. Finally, we will discuss next steps and answer any questions you may have. So let's get started. So what is medical coding? A medical coder is a trained professional who converts worded diagnoses and procedures recorded by a healthcare professional into alphanumeric codes using a medical coding classification system. The classification system determines the amount for which healthcare providers will be reimbursed if the patient is covered either by Medicare, Medicaid, or other insurance programs. Essentially, a medical coder is responsible for money. With the right specialized training, medical coders have a direct financial impact of a healthcare organization. If a medical coder undercodes, meaning they are not coding to the highest level of specificity, then the healthcare organization may not get the proper amount of reimbursement for the services rendered. Compounded over time, this may cause an organization to go under. For example, if a medical coder only codes for unspecified diabetes, even though it is documented and the facility spent more time and resources to care for a patient that actually had diabetes with neurologic complications, then the healthcare organization may miss getting paid for the time and resources to treat those complications from third-party payers. If a medical coder overcodes or upcodes due to the lack of experience or knowledge of proper coding guidelines, then it can expose the healthcare organization to steep federal penalties, fines, or sometimes imprisonment for fraud, waste, and abuse. This is why it is important for healthcare organizations to invest in medical coders with a solid foundation in not only coding guidelines, but also basic science courses such as medical terminology, anatomy physiology, and pathophysiology. Medical coders are the first line of defense in catching sloppy documentation or hurried intake or missed information that could lead to a pattern of denials or medical coding errors. Let's take a look at how information flows for medical coding. In this oversimplified example, a patient visits his or her doctor. This is known as an encounter. The doctor documents all conditions, diagnoses, symptoms, and procedures. It then gets passed on to the medical coder who then translates those diagnoses and procedures into ICD-10 and CPT code using the appropriate coding guidelines. From there, it is then passed on to the medical biller who submits the super bill to third-party payer for payment. Lastly, the biller follows up on any outstanding and denied claims, and the process repeats again. Let's take a look at this encounter through the eyes of a medical coder. We are going to wear our investigative thinking caps and analyze and abstract the necessary information in order to code this example. First, let's verify if we are coding for the correct date of service. Next, we notice that this encounter was at ABC Family Practice and therefore is an office visit and will be using outpatient coding guidelines. Next, let's verify that the name, sex, and other identifiers in this encounter also matches the patient insurance information in the rest of the chart. Again, as a medical coder, you are the first line of defense in making sure that the information is accurate to reduce any claim denials or loss of revenue. Having a mixed patient chart should be returned and corrected. Medical coders should also note the age and sex of the patient when reviewing the encounter to ensure whether or not diagnoses and/or procedures make sense. For example, if you have a 38-year-old female patient but the prostate was removed, does that make sense? Is it a mixed patient record? Was there an error in physician documentation? Or does this need to be queried? So let's get back to this example. The patient's chief complaint was pain and swelling in the right ankle. He tripped over rocks while skiing and twisted his ankle. X-rays were done and found to be negative for fracture. Final diagnosis is right ankle sprain, deltoid ligament. Plan is to ice, compression wrap, and crutches. Elevate foot, keep weight off foot for 1 week. As a medical coder, you will also need to know different medical abbreviations. In this example, OTC is over the counter and PRN is Latin for Proranata, which means as needed. Call office if not better in 2 weeks. So if we look at this example, the patient just sprained his ankle. More specifically, it was documented that the sprain was in his ankle right side, and even more detailed, the deltoid ligament in the ankle. So how do we code this? As medical coders, we code using coding books or an encoder, which is just your medical coding book in an easy-to-use logic-based computer program. In this snippet, we look at the main term in the alphabetic index, which is sprain. Under your main term sprain, you can see several subterms that further describe the type of sprain. If you follow the vertical red line, all of these terms are used to further detail the type of sprain. In our example, we know that the patient had sprained his ankle. If you follow the purple vertical line under sprained ankle, we can see that there are even more subterms that further describe which part of the ankle. Again, in our example, we know that this was the deltoid ligament, so we get the code S9342, but we're not done yet. We take the code S9342 from the alphabetic index and cross-reference it to the tabular section of our coding books. The tabular section of a coding book has further instructional notes, exclusions, and more detailed questions to figure out your last few digits of your final code. Remember, as a medical coder, you must code to the highest level of specificity. If we look up the code S9342, we have 3 options for the 6th digit. 1 for the right ankle, 2 for the left, and 9 if it was unspecified. We know from our example that the patient had sprained his right ankle. So now we have S93421. Again, we may not be finished yet. We have to check if there is a 7th digit. If we take a closer look at S93421 again, it gives us 3 options for the 7th digit. A for initial encounter, D for subsequent, and S for sequelae. For this example, it was not specified, so we assume that it was his initial encounter. We are then left with a diagnosis code S93421A, sprain of deltoid ligament of the right ankle, initial encounter. Now all we have to do is rinse and repeat and get your external cause codes. To save time in this open house presentation, I'm not going to walk you through that, but it is the same exercise. I often get asked, wait, why don't you have codes for the pain and swelling? Well, according to official coding guidelines, signs and symptoms that are associated routinely with a disease process should not be assigned as additional codes unless otherwise instructed by the classification. Pain and swelling is integral or assumed to be part of the sprain and therefore not coded separately. So here are our final codes: S93421A, W010XXA, Y9323, Y92838. There were no procedure codes. So the top 8 skills of a medical coder are detail-oriented, organized, ethical, social, analytical, curious, computer proficient, and adaptable to change. If you can see yourself having some or all of these skills, medical coding might be a great career for you. These are the different types of medical coding. Here are just a few. Inpatient coder, outpatient coder, professional services or profi coder, E&M or evaluation and management coder, risk adjustment or HCC coder, home health coder. If you want to grow into this profession, you can transition into other facets in other parts of the revenue cycle, information governance, or even informatics, such as CDI, health information technician, or DRG validator. To even further your career, you can become a coding auditor, trainer, educator, supervisor, or manager. So, as a medical coder, you will never get bored. The American Health Information Management Association, or AHIMA, has an excellent online career map that helps other professionals see what their options are. I highly recommend checking out this resource. Here is a couple of examples of where you can take your medical coding career. As a coding professional, you then can become a DRG validator, coding trainer, coding educator, coding manager, or you can even get into information governance and become a health information technician or HIM manager. As a coding trainer, you can elevate yourself to become a coding director or coding manager. Now that we have a better understanding of the different types of medical coding positions that are available, you should know that there are two main organizations that set the standard for medical coding profession and offer coding credentialing examinations. The main organizations are the American Health Information Management Association, also known as AHIMA. They are based out of Chicago, Illinois. AHIMA.org is their website, and their largest coding credential is a Certified Coding Specialist, or the CCS. They have other credentials such as RHIT, RHIA, and CCA. If you would like to get into hospital-based coding, we would highly recommend obtaining your CCS credential. The other organization is the American Academy of Professional Coders, or AAPC. They are based out of Salt Lake City, Utah. AAPC is their website. Their largest coding credential is a Certified Professional Coder, or CPC. They also have other credentials such as the CRC, CIC, COC, and CPMA. If you do a quick medical coding job search, which I highly recommend you do, the following are the most popular coding credentials that employers are looking for depending on the type of medical coding position. As previously mentioned, if you're looking to get into hospital-based or inpatient or outpatient medical coding, employers will typically look for the CCS, or Certified Coding Specialist credential. This is because a majority of what the credentialing examination focuses on is the inpatient and outpatient coding guidelines. This is your ICD-10-CM and PCS for inpatient procedural coding, and CPT outpatient procedural coding. The Certified Professional Coder, or CPC examination, focuses mainly on outpatient coding guidelines. This is your ICD-10-CM diagnosis coding, as well as your CPT outpatient procedural coding. Lastly, the Certified Risk Adjustment Coder, or CRC, is a relatively new coding credential for risk adjustment or hierarchical conditions category HCC coding. This examination will focus mainly on ICD-10-CM diagnoses coding, but specifically only certain diagnoses that risk adjust for value-based payment models. Therefore, if you would like to get into facility or hospital setting, the CCS credential is a great place to start. If you would like to code in the physician office setting, the CPC may be a better fit. Lastly, if you would like to code for health plans, providers, or other healthcare entities, the CRC may be what you're looking for. However, since the CRC is a relatively new coding credential, there are many employers who will consider either the CCS or CPC for risk adjustment coding. Now let's take a look at some of the eligibility requirements. For the CCS, most candidates may qualify to sit in for the credential examination by satisfying the education portion. This means that candidates must complete the following courses in anatomy and physiology, pathophysiology, medical terminology, reimbursement methodologies, intermediate or advanced ICD-10 diagnoses coding, procedural coding and medical services, or CPT/HCPCS coding. For the CPC, AAPC recommends to have at least an associate's degree, but it is not required. Moreover, proof of education is not required to sit in for the CPC examination. However, they expect coders to be able to perform not only in an exam setting, but also in the real world. If candidates pass the CPC exam, they are automatically assigned a cpc-a apprentice status attached to the credential until they can successfully prove that they have 1 to 2 years of coding experience. For the CRC, again, AAPC recommends to have at least associate's degree, but it is not required. They also recommend of having at least 2 years of experience in risk adjustment coding or successfully complete a coding risk adjustment coding course. From our experience as a school teaching medical coding for over 20 years, there is a common thread among all of the different coding credentials. Having a strong foundation in these courses may not only help you successfully pass your credential examination, but help you become successful in the real world. These courses are your basic science courses, medical terminology, anatomy physiology, pathophysiology, and pharmacology. Coding courses such as ICD-10 CM diagnoses coding, ICD-10 PCS procedural coding, CPT coding, and reimbursement methodologies. Tri-County Allied Health School can only make recommendations. Please make sure you do your due diligence in reviewing the AHIMA and AAPC websites to see which courses you may need for your personal situation. Now let's learn more about Tri-County Allied Health School. AE & Associates is a staffing company specializing in medical coding, auditing, billing, and education. Our owners, Arnold and Esther Ardavella, a husband and wife medical team from the Philippines, immigrated to the U.S. and recognized the growing need for highly trained medical coding professionals in the Southern California area. The president, Arnold Ardavella, decided that he would grow and develop his own coders according to what his clients were looking for. He taught other friends and family who were also medically trained in the Philippines and immigrated to the U.S. to become medical coders by teaching in his garage. That's how Tri-County Allied Health School originally came to be in 2000. Since officially forming in 2007, Tri-County has had hundreds of students graduate, pass their coding credential examinations, and go on to have long careers in medical coding. Here is a list of what Tri-County Allied Health School currently offers. We offer courses in basic sciences, coding, and credential examination preparation, such as the CCS, CPC, and CRC. However, due to the COVID-19 pandemic, we have closed our physical classrooms and moved online. And due to the demand, we are only currently offering CCS test review. To join our waitlist for the CPC and CRC, please email our administrative staff. Tri-County Allied also offers specialty courses once you have already become an established medical coder and would like to get into other types of medical coding. These courses include CDI, interventional radiology, evaluation and management, and outpatient surgery. We also offer workforce development courses such as an encoder training, resume and interview skill workshops, and networking workshops. We also offer continuing education units in order to satisfy your requirements to maintain your coding credential. Let's take a look at a couple of examples of some of the type of students that enroll in our school. In our first example, Mary previously worked at a bank but is now a stay-at-home mom. Her main motivation is to work from home and to have a flexible schedule so that she can drive her kids to and from school and soccer practice. She knows that she would like to take the CCS because of the many opportunities that it will be available to her. Because she does not have a medical background, it is recommended that she takes the following courses: Med-Term, A&P, Pathophysiology, Pharmacology, ICD-10-CM, PCS, CPT, Reimbursement Methodologies, and the CCS test preparation course. In our second example, Jack is a foreign medical graduate or an international medical graduate from Syria. He practiced medicine in his home country for over 7 years. His end goal is to eventually become a clinical documentation improvement specialist. Because the majority of these positions are in a hospital setting, the CCS coding credential is the best bet to get into. Because it is assumed that Jack has completed the basic science courses before medical school, he can jump straight into taking the coding courses. It is recommended that Jack take CM, PCS, CPT, Reimbursement Methodologies, and the CCS test preparation course. At the end of this presentation, you will find links in the description box below for our most recent course catalog, a slide deck of this presentation, as well as a free copy of our medical coding course roadmap. This guide may help you better decide which credential and which courses may be best suited for your personal situation. So why choose Tri-County Allied Health School? We believe in quality education. We have been in business for over 20 years and have a proven track record of helping students pass their coding credential examinations. We have a pulse in the industry by working with employers such as AE and Associates and others all over Southern California and all over the nation. We have multiple modes of learning, and we have an experienced and qualified faculty and a very supportive staff. Speaking of our experienced faculty, as previously mentioned, Arnold Ardavella, our president and coding instructor at Tri-County. He is a foreign medical graduate from the University of the Philippines and has over 30 years of medical coding experience and has a slew of medical coding credentials under his belt. He is also an AHIMA certified ambassador, ICD-10-CM PCS trainer, and an AAPC PMCC approved ICD-10 CM instructor. Lori Stutzman is our school's program director and coding instructor. Prior to becoming a medical coder and joining our school, Lori practiced as a physician assistant in the surgical specialty, as well as family medicine for over 10 years. She has also taught medical terminology and was the clinical coordinator at Western University of Health Science Physician Assistant Program in Pomona, California. Lori holds a CCS, CPC, cpc-a, COC, and CIC coding credentials. Mark Fernandez is also a foreign medical graduate from Manila, Philippines. Like Arnold, he graduated from the University of the Philippines and practiced medicine for over 12 years. He is a certified coding specialist and currently works as a medical coder for a hospital. He is currently teaching our basic science courses. Lastly, Mark Ardavella is one of our other basic science instructors. Mark began his coding career at AE & Associates as a CCS coder and project manager. He has practiced as a registered nurse in the emergency department of a level 1 trauma center before returning to the world of coding. Mark obtained his bachelor's of nursing from the Cal Baptist University and has a CCS from AHIMA. Here are a couple of testimonies from our previous graduates. Christopher is a graduate from our 2014 cohort. Time was one of my biggest obstacles when it came time to enrolling at Tri-County Allied Health School. I had a toddler at home and juggled with the idea of whether or not I could handle school, family, and work all at the same time. While it wasn't easy, the short sacrifice was worth it, as I now have more free time working as a medical coder than I ever did before. Felicia is one of our graduates from our 2012 class. All of my teachers were knowledgeable and made it a priority for their students to truly understand every part of a medical record, as well as learning anatomy and physiology and coding itself. I was only 19 at the time and had zero medical background. Every section of the course was detailed, and my teachers were ready to answer all questions I had as a student. Let's review some of our school policies. All of courses will be paid in full prior to or on the first day of class. There are no refunds. Only one course may be purchased at a time. We keep record of all students who have passed or completed the course. Information is available to current or future employers. Course completion is recorded as complete or incomplete. Course completion is defined as a student completing 80% or more of the course assignments. All assignments are pass-fail basis. Pass or completion of a course is based on participation, not performance. Students must achieve 80% participation to pass and complete the course. Attendance is mandatory, and missed opportunities to complete assignments or attend class will affect the participation score. No certificates of completion are issued. AHIMA or AAPC certifications will serve aid to students in gaining employment. There are no prerequisites for any of the classes. Students have the option to take courses in any order they think is suitable for them. No textbooks or workbooks are provided for any classes. Handout materials are included in the tuition. No federal or state funds will be accepted for payment of tuition. Tri-County Allied Health School does not offer any financing or payment plan options for tuition. Here are a few next steps. Check out our medical coding course roadmap, download our most recent course catalog from our website, schedule to meet with an advisor, or check out any of our videos on YouTube. Thank you for attending today's virtual open house. Please visit us at www.tricountyallied.edu. Should you have any questions, feel free to reach us by phone or email at any time.